Bill Cole, question: Medicaid expansion and subsidies in the ACA that provided HI health insurance for 20 million means the Democrats have done nothing for the working class. Oh, I think that's a rhetorical question. Take it away, Malika. Take it away, Malika and Matt. I think that's John Favreau sliding into. I'm just kidding. We like you, Bill Cole. Matt or Malika, you want to take that on?
I mean, how much is the expansion? Like, how much are people paying? He's saying that it's Medicaid expansion.
Let me see. Sorry.
No, he's pushing back on this idea that Democrats offer nothing to the working class because we gave you Rubes the Medicaid expansion. Be grateful.
They did the Affordable Care Act, which had Medicaid expansion. Now, Medicaid expansion was the best part of the Affordable Care Act, but Medicaid is still, what people forget about Medicaid is that people are not on Medicaid permanently. It's a means-tested program. So if your income goes up or you fail to continue filling out the paperwork, you come off of it. So, I mean, there's longitudinal data on this for Medicaid recipients. Within a year of getting on Medicaid, third of Medicaid recipients are uninsured because they roll off the program. They got nowhere to go. So it's like, it's great. I mean, they would have never even had the period of coverage under Medicaid. So like, good, you had like eight extra months of health insurance. But like, it's a shitty experience to still live in that little niche because you're constantly losing it. I mean, I know someone who, she has this job that is some sort of like caretaker job. And so she's like on the clock for a month and then off for a month and then on the clock for a month and then off for a month. So she loses her Medicaid every month. And it's like, and she's got to sign up for an ACA plan. Every time you sign up for a new plan, by the way, your deductibles start over. I mean, it's still just a hellish experience navigating the healthcare system, even if you're poor and you qualify for Medicaid. So,
Malika, do you have any response to that?
I mean, I think it's also interesting that that's his, like, does he have any more examples? Because I think, obviously, if we're not being absolutist, anybody could say that they've done something. The Republican Party has done something for the working class.
Right. Democrat or Republican? Oh, you're saying Republican. You're saying, right. Yeah, I got it. Yes. Yeah.
Anyone's done something for some constituency. But right now we're talking about an unprecedented pandemic where people are dying at disproportionate rates. They're going to need more than, just rapid COVID tests or whatever it is that Joe Biden is promising. And he's saying that he's going to veto Medicare for all. So we're past that point of thinking about 2008 and 2012 problems. This is 2020. So if it takes you, if you need to go back 8 years to find out the last time that Democrats did something meaningful for the working class, then you're not living in what is right now a hellish experience for millions and millions of working class Americans. And that's the problem in itself. If it takes you that long to think of something that can meaningfully affect their lives.
Right. Yeah. I mean, I think that you can acknowledge that things were some things were good, but also he arrived to that fight with the hand behind, tied behind his back.
Yeah. I mean, it always depends on what you want to compare it to.
I mean, I think.
If you want to compare it to what came before, then you can say, hey, more people on Medicaid. That's a positive.
Right.
If you want to compare it to like every other country in the world, it's like you had a period here that we only get in American politics every 20, 30 years. It seems like you controlled all three houses. You even controlled at a point 60 votes in the Senate. You could have done anything on healthcare. We're the only country in the world that doesn't, in the developed world, that doesn't have universal healthcare of some sort. Not even Medicare for all. I mean, obviously, I think that's where you should go with it. But you have everyone covered in some way. You could have done that, and they didn't do it. And it's like, so what? We got to wait another 30 years, and then maybe we can cover another half of the people who are uninsured. So, like, what was possible, what should have been done, what is done in other countries, it falls so far short. I mean, I've pointed this out before, and it really irritates me because, people talk a lot about, Trump was going to repeal Obamacare and like how many extra people would die. And, they get real into these like body counts from uninsurance and things like that. There's 30 million uninsured people in the U.S. Like we're killing, tens of thousands of people every year from lack of insurance. And that was, that is Obamacare. That's the, that's the healthcare framework that he put forward when he had a chance to like reform the system, which we don't get very often. So, it depends on your baseline, depends on what you want to compare it to, but it's very underwhelming. That's what I would.
And it's pretty shocking to me that. Go ahead, Katie. Sorry.
I was just saying, and means tested programs are not the way to go because they are stigmatizing, and they're not as sustainable,
robust.
And they're not as robust. Yeah, it's such bullshit. If you even believe in means tested stuff, but if you believe in those programs, first of all, it should be universal because that's just the best thing to do. But second of all, it's when you have buy-in, that's what keeps them safe.
Yeah, we saw with Medicaid, Trump's HHS, they created this waiver system for states to apply these work requirement rules on Medicaid. I think 3 or 4 of them did, kicking tens of thousands, hundreds of thousands of people off of Medicaid because the people who were on it weren't working enough and whatever. And guess what? I didn't see that on Medicare. I didn't see that on some of the other benefit programs, but you have a healthcare program that's just for the poor for the most part. And then they're a little bit more open to saying, yeah, you can make it much harder to stay on. You can put all these restrictions on it. That's what they did. As soon as Obama left office, the first Republican in is go ahead and kick tens to hundreds thousands of people off of Medicaid through these heightened eligibility restrictions, which we're going to push through the executive through rulemaking and blah, 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 blah. It is vulnerable, and who's going to stand up to fight against it? The unions put in a valiant effort, but there's no lobbyist for the poor, or there's no big backlash in society. Most people probably aren't even aware that happened. So
yeah.
And last 2 things, and then so Bill Cole writes back. So Obama got the ACA passed, wanted a public option, wanted to improve it, but 2010 happened with Lieberman and right-wing Dems. Blame us, not Dems.
Oh, you passed one thing and waiting. You, like Matt said, this is a historic moment that comes along 20, 30 years. You can pass whatever you want. Shut up.
Obama, and I mean, you only need 51 votes to pass things if you're serious about it. This is something Democrats really like to do, is they, like you said, tie their hand behind their back.
Yeah.
And be like, oh, we couldn't do it.
Exactly.
So if you want to kill the filibuster to pass a bill that's going to save literally tens of thousands of lives a year, maybe that's when you push that button. And what's notable is it only took them about a year and a half later, and they did push the button in order to confirm judges.
Yeah.
It's not like this was an impossible thing. You did it. When you cared enough, which for you meant confirming judges, you got rid of that 60-vote rule.
Right.
You could have done it to give everyone health care.
It's shocking to me that it's also shocking to me that they didn't even do we're obviously ideologically kind of in favor of this kind of thing. I mean, I don't know, but it seems shocking to me that they didn't even pass things that would be self-serving to themselves. For example, abolishing the electoral college, or DC statehood, or these kind of things that when they had that kind of brief window,
would have been
they
strategic.
just didn't do any. Yeah,
right.
So